Dr. McDougall is very well known. He has educated thousands and thousands of people in this country and in this world on the benefits of a vegetarian lifestyle. He is one of the foremost authorities in this area, and his clinic and its results have proven that this type of lifestyle can reverse and even prevent chronic diseases of different types. When I hear about his program, seeing that people with adult onset diabetes can get off medication many times in a few days, people with hypertension can get off their blood pressure medication in a few days, people with high cholesterol can reverse it and lower their cholesterol in a few days. I'm glad to have him here again, and I want to now welcome him to our pulpit here at Modern Manna Health and Healing Crusade, Dr. John McDougall.
Thank you, sir. Okay, let's see. A couple things came up during the dinner break. One is that a couple people said to me that what I recommend is difficult. Well, I'll tell you what difficult is. Difficult is asking for a seatbelt extender when you get on the airplane. Difficult is taking blood pressure pills that make you impotent. Difficult is having your chest exposed to stale operating room air. Difficult is having your breast amputated. Making oatmeal is easy. I mean, think about what people go through, the suffering, the pain, the work that they go through to stay sick. And it's so easy to go for a walk and make the right choices at the dinner table. Now, the other thing that came up, and I think it had to do with another speaker that you had either today or yesterday, was the issue of supplements, essential fatty oils, vitamin supplements, mineral supplements, and so on. Well, let me tell you my feelings about this. I have a question for you. How many of you have met people who have lost 100 pounds taking supplements? How many of you have met people who've gotten off their blood pressure pills, their heart pills, their arthritis pills, their diabetic pills, taking supplements? I've never seen it. But every day I get an email, a personal contact like I did here after our break. Every day I get a message from somebody who says that that's exactly what happened to them when they changed their diet and decided to exercise. So personally, I just go for the big bang for the buck. You know, if somebody else want to mess around with supplements, make a lot of money. Maybe they do a little good, maybe they do a little harm, but the real benefits come from something that costs absolutely nothing. In fact, reduces your food bill by 40%. The other answer I have for people who believe that supplements are the answer: how many of you know people with deficiency diseases that would benefit from supplements? How many of you have friends with beriberi, scurvy, pellagra, flaxseed oil deficiency, amino acid deficiency? If you're looking in this direction for the solution of the problem, you won't find it. But if you change your vision from looking to deficiency 180 degrees to looking toward excess, you'll see the answer. How many of you have friends who have diseases of excess? Excess calories, excess fat, excess salt, excess animal protein. The problem, isn't this working? Okay. Do you want me to take this out? This one's working. Okay. The problem is over here. The problem is excess. You're not going to treat diseases of excess with supplements. It's never going to work. It should be obvious. The other thing that I feel is when somebody says, and I know I'm not winning a popularity contest by discussing this, but I'm here to tell you what I really believe. When somebody says that that there's a supplement, a vitamin pill, mineral combination, etc., that is just perfect for your nutrition. What that says to me is that you believe there's somebody sitting in a lab in some factory that's smarter than God. Okay? And they took and they made a pill that's better than God's own creations. And I just don't believe that. And I know when they do things like that, they create imbalances, and those imbalances are often paid for as a price of bad health. Now, there are some benefits too, but these are medicines. These are not foods. Now, it's not that I don't recommend supplements. I do in certain circumstances, and we'll get there in a few minutes. But I don't recommend them as a daily tonic, a potion, a secret to good health. You can use them as medicines. They do cause some effects in the body. For example, flaxseed oil suppresses the immune system, which may be good for somebody who has rheumatoid arthritis. But somebody who's wishing to fight off cancer and viral infections, it may not be so good. So, on that note, let's go on. Let's talk about some goals we could have in life. One of the goals, probably the most important goal people have, is to look great. I mean, people do almost anything to look great. They'll sacrifice health and wealth to look great. I mean, consider, we spend thousands of dollars on suits and dresses to cover up the unsightliness. We hang expensive jewelry from the body, hoping it will increase its value. And we ride around in cute little sports cars thinking people will notice the car and not us. We'll sacrifice our health, too, to look great. We'll go on any kind of diet. We'll eat baskets full of grapefruit or little canisters of ground-up cowhide. Yeah. Little packages of protein powder. Take any kind of pill, even if it will destroy your heart valves. We'll go through life-threatening surgeries like having the teeth wired together, having the stomach stapled to make it smaller, and having the intestines isolated out of the flow of food. We'll do that to look great. So that's why I put goal number 1, look great. And wouldn't it be great if we could look great and never be hungry again? And that we can do if we know the truth. Next slide. Obesity is increasing in the United States in face of the fact that we have so much discussion about diet. We've had the high-protein diet people in control for the last 10 years, telling you to eat as much meat as you possibly can stuff between your lips. And yet, obesity has increased from 12% in 1991 to 18% in 1998. According to Tufts University, 63% of men are overweight and 55% of women are overweight in this country. Amazing, isn't it? You know, I think the reason is, I think it's because you don't even have to get out of the car to get fed these days. It's not because the food is really any richer, it's just more available. I think that's the problem. Next slide. If you're interested in long-term weight loss, then the way to accomplish this is through diet and exercise. And that diet is a high-carbohydrate, low-fat diet. There are 3 principles that I'm going to share with you now that make that diet work. The first principle is the stomach is filled with fewer calories, the principle I introduced to you before dinner. Carbohydrates are low-calorie density foods. Fats are high-calorie density foods. The second principle I'm going to introduce to you is that excess carbohydrates are not usually converted to fat, but the fat you eat is the fat you wear. And the third principle is carbohydrate satisfies the hunger drive. I have this almost uncontrollable impulse when I debate some of these diet doctors like Atkins and Sears and Bate of the Sugar Busters. I have to grit my teeth and bite my lips to keep from saying, it's obvious the diet doesn't work. If it did, you wouldn't look like that. Next slide. Really, when in front of the USDA debate, I almost pointed out in front of 50 national cameras that Atkins is at least 60 pounds overweight. But I bit my lip and I did the right thing. Okay, one of the first principles I shared with you last time was that when you switch from the American diet to a starch-based diet, you change the calorie concentration of the food fourfold, which means to you in practical terms that now you can eat twice as much food and you'll take in half as many calories. There are a couple of things that you need to know about these foods to learn the next 2 principles. One is that The rich American diet is full of foods that are high in fat. For example, butter is 100% fat, cheese is 70% fat, beef can be between 60 and 82% fat. These are low-fat foods. Rice is 5%, corn is 9%, potatoes are 1% fat. Most of your fruits and vegetables, 3, 4, 5% fat. The next thing you have to know is the carbohydrate content of these foods. There is no carbohydrate in beef, chicken, fish, lobster, or any other animal food. 0 carbohydrate, except for dairy products. Cheese has 2% of the calories as carbohydrate. Your oils like olive oil, flaxseed oil, butter, margarine, 0 carbohydrate. Whereas your starches, vegetables, and fruits are 75 to 85% carbohydrate. The body does the most efficient thing possible with everything that we feed it. And so when we eat food, we take in protein, carbohydrate, and fat. And the body's going to do the most efficient thing possible with these three potential calorie-giving substances. It takes the protein and it utilizes it to build things, like to make hormones or repair cells. If we take in more protein than we need to build things, as I told you before dinner, the body dumps that protein out into the urine because it's too wasteful to convert it into fat for storage, and it's too inefficient to put it into the muscles. So it's just most efficient to dump it out. To burn protein for energy would be like burning your oak furniture in your fireplace in the winter to keep warm instead of regular firewood. It wouldn't be the thing the body would do. Now, when we eat carbohydrate, the body does the most efficient thing possible with it. We eat the carbohydrate, the body uses the carbohydrate to run the machinery. That's what the cells prefer to burn, is carbohydrate. It's the clean fuel of the body. If we eat more carbohydrate than we need for daily activity, the body will take 2 pounds of it and store it invisibly in the liver and muscles as glycogen. If we eat more than the 2 pounds we need for daily activity, the body will store 2 extra pounds, and then it will take the rest and it will burn it off in various oxidative reactions because it is too inefficient to turn carbohydrate into fat. It costs too much energy to do it. So under ordinary circumstances, the body does not convert carbohydrate into fat. Now, when we eat fat, the third potential calorie-giving component, the body does the most efficient thing possible with it. What it does is it moves it from the fork and spoon effortlessly through the bloodstream, and it sticks it in the body fat. So effortlessly that it doesn't even change the chemical structure of the fat. So that I can come up to you with a needle, I can stick it in your buttocks, thigh, or abdomen, I can suck the fat out, take it to the lab, analyze it, and I can tell what you like to eat. If you like cold water marine fish, you're going to be full of omega-3 fats. If you take flaxseed oil, you're going to be full of omega-3 fats. You eat lots of olive oil, you're going to be full of monounsaturated fats. You eat margarines and shortenings, you're going to be full of trans fats. The fat you eat is the fat you wear effortlessly. So think about that next time you're pouring a little bit of olive oil on your salad. What's that olive oil going to do? It's going to be stored in the fatty tissue as the metabolic dollar for that day when no food is available, which never comes. Next slide. So you spray a little bit of PAM on your pan, that's where it's going to go. It's going to be stored. You take vitamin E capsules that are full of oil, what do you think is going to happen to the oil? It's going to get stored. It's what the body does with fat. Now, the third principle that I want to share with you may be the most important principle that some of you have ever heard. It is particularly important for those of you who think about food all the time. Some of you think about food so much that you've invented a name for yourself. You call yourself an obsessive-compulsive overeater. Some of you think about food so much that you've hired people to call you names. You hire the psychiatrist to tell you you have an eating disorder. Well, I'm here to tell you this is not an emotional or mental problem at all. The reason you think about food all the time is because you do not eat. You do not eat what the body is looking for satisfaction. Now, we have all these drives in life that are basic, innate drives of the human body. We have the drive for sex, we have the drive for money, we have other kinds of drives, and they're satisfied by very specific things. And the more important the drive is, the more specific it is satisfied by such a substance. For example, Breath is satisfied by what? Not air, not air. If I made a mixture of gases and I put everything in it but oxygen, what would happen? You'd be huffing and puffing and dead in 3 minutes even if I called it air. What is the body looking for? Oxygen. And how about the thirst drive? What's the thirst drive looking for? Right, not beer, not orange juice. It's looking for water. Only water satisfies the thirst drive. All right, what does hunger look for satisfaction? If you say food, that's like saying air. It's something much more specific. It's carbohydrate. It's carbohydrate that satisfies the hunger drive. Now remember the stomachs you saw a couple of minutes ago. There's no carbohydrate in any meat, eggs. 2% of the calories are carbohydrate in cheese. No carbohydrate in butter, margarine, olive oil, and so on. Whereas 75 to 85% of the calories in starches, vegetables, and fruits are carbohydrate. Well, see, I used to eat from that first meal plan, the no carbohydrate foods. And I can remember what it was like. I can remember as a young man and a child getting a plate of meat, and dairy, and poultry, and covered it with oils, and eating down that big plate of food. And I'd get all done, and my body'd say, Johnny, that's interesting, but when are we going to eat? So I'd go get another plate of carbohydrate-deficient foods, and I would chew and swallow, and I knew something was happening because I felt a little distension here. And then I'd get my third plate of carbohydrate-deficient foods, and after that plate of food, I finally got my signal that it was time to stop eating. I was now overstuffed and in pain. But I was still ravenously hungry, and if I had room, I'd have stuffed one more pork chop on in, because I hadn't given my body what it needs for satisfaction of the hunger drive. This has been determined in multiple studies that what satisfies the hunger drive is carbohydrate. 2 slides. Next slide. Next slide. Oh, I think you went one too many. Oh, next slide. Okay, it's okay. All right, this is a study for the American Journal of Clinical Nutrition. I mean, scientists know this, the things that I've been trying to tell you. They say the dietary carbohydrates do not appear to increase an individual's fat content by de novo lipogenesis. That's by the production of fat from carbohydrate. Next slide. Next slide. One of the most satisfying foods that we can possibly eat is a potato. On satiety scores, when they feed people various kinds of foods and they ask them how they feel in terms of and they ask them how they feel in terms of the food, they come up with something called a satiety score. And potatoes are the most satisfying of all foods around. Potatoes are 7 times more satisfying than croissants and over twice as satisfying as beef and cheese. Next slide. Again, various studies that have been done that bring out these principles. John Bundell, foods high in dietary fats have a weak effect on satisfaction, which leads to a form of passive overconsumption and a disproportionate weak effect on satiety. You see, so the scientific literature is very clear on this, even though people are teaching you different things. Next slide. We are designed as seekers of carbohydrate. There's a very popular book out there right now. It's Oprah's New Diet. It's called The Carbohydrate Addict's Diet. You've probably heard about it. Carbohydrate Addict's Diet teaches you that you are addicted to carbohydrate, and people buy into it. The reason they buy into it is people love carbohydrate. Recall, on the tip of the tongue is a sweet-tasting taste bud. There's no taste bud for fat, no taste bud for protein. There's only a taste bud for carbohydrate. We are designed as seekers of carbohydrate. And so what I told the Hellers when I debated them in Orlando last November is, yes, we are carbohydrate addicts, just like we're water addicts and we're oxygen addicts. We are addicted to these life-giving substances. And the fact that you enjoy carbohydrate is no mistake. It's no accident. It's no disease. It's what you were designed to do. Next slide. I run a 12-day program at St. Helena Hospital, and we measure the weight loss results at 11 days. The average weight loss in our men, eating as much as they want, as often as they want, is 3.6 pounds. If you start overweight, the average weight loss is 5.3 pounds. In women, the average weight loss is 3 pounds. If you start overweight, the average weight loss is 4 pounds in 11 days. Now multiply that over a month, and you're looking at 8, 12, 16, 20-pound weight losses, doing something normal and natural. You're not doing something superhuman like suffering the pain of hunger. You're not doing something bizarre like eating an all-meat diet or taking potions or pills. You're just eating a lot of delicious food. And that's why you can maintain it for a lifetime. Next slide. I work with Blue Cross Blue Shield of Minnesota. And what I do now is I take care of their employees. And what we've shown over the last year is that we can reduce the cost, the health costs of their employees by 48%. At the same, and this is in high utilizers, people who utilize a lot of health care. At the same time, we took this group and reduced their health expenditures based on Blue Cross's claims data by 48%. The overall increase in expense for Blue Cross was 18%. So we effectively reduced the cost by 65% for their employees. Well, this same group, followed over a year, we have an 8% weight loss, which is a 16.5% pound weight loss, and people maintained over a year. I just did the data for our second group, and the weight loss in people who followed the program was 25 pounds on the average, maintained over a year. Next slide. There's a study, it's a registry, it's called the National Weight Control Registry, and to be part of that registry, you have to be a successful dieter, in the sense that you have to keep off over 30 pounds for more than a year. And they have about 300 people that belong to this registry, and consistently the people who are in this registry follow low-fat diets. Not the Atkins diet, not high-protein diets, not taking diet pills. They follow a low-fat diet, and that's how they succeed. Next slide. One of the ways doctors, dietitians, dentists look at foods is in terms of calories per gram. A gram is about a 1/30 of an ounce. Olive oil is 9 calories per gram, lard is 9 calories per gram, beef, cheese, and pure white sugar are 4 calories per gram. Bread is 2.5 calories per gram, beans 1.2, rice 1.2, potatoes 0.8, and fruits and vegetables about just 2 to 3/10 of a calorie per gram. Now what I want to do for a moment is I want to compare two foods that all of us have strong feelings about and see how they fit in terms of what we just learned. I want to compare health food olive oil with killer white sugar. What you notice here is that olive oil is 2.25 times more concentrated in calories than pure white sugar is. Olive oil is 100% fat that you're going to wear, whereas sugar has no fat to wear. Olive oil has no carbohydrate to satisfy the hunger drive, whereas sugar is pure carbohydrate to satisfy the hunger drive. So when it comes to your personal appearance, next slide, which is worse, sprinkling a little bit of sugar on your oatmeal or dunking your bread in the olive oil at the dinner table? You might as well just make a little slit right here and pour that olive oil right on in, because that's where it's going to go. Next slide. High-protein diet books. There are all kinds of them out. I have to address this because I know many of your friends and relatives are on these programs. Next slide. They have done some good. They've made people aware of the harmful effects of sugar and refined foods, and people have lost weight, sometimes quickly, but rarely permanently. Next slide. And all of these books have as the premise of why the diets work is because they lower insulin levels. I mean, this is the hype word, insulin levels. They lower insulin levels. And they blame insulin as the evil hormone on what makes people fat. Now, insulin's job is to distribute the various calorie-giving substances that you eat after your meal. So you eat, what happens is insulin takes and puts the carbohydrate into the cells so that the carbohydrate can be burnt. It takes and stuffs the fat into the fat cells for storage. It causes the protein to be involved in synthesis reactions. Okay, that's its job. And the whole theory of all of these diet books is that when you eat carbohydrate, you make so much more insulin, which makes you so much fatter because it stuffs more fat into your fat cells. But these folks don't look at the literature. Next slide. If you look at an article in the American Journal of Clinical Nutrition where they actually tested the amount of insulin released by different kinds of meals, what you find is brown pasta releases less insulin than beef in people. Interesting. Next slide. White pasta releases less insulin than cheese. Next slide. And porridge releases less insulin than fish. So how do they come off telling you that the way to keep your insulin down so you'll be thin is to eat less carbohydrate and more fish, cheese, and beef? The way they do it is they entirely ignore the scientific literature. Next slide. It is important to lower insulin levels for an effective weight loss, and the way to do it is with diet and exercise. This is work out of the Pritikin program, which uses a diet similar to what I recommend, and also exercise. And they reduced insulin levels from 40 microunits to 27 microunits. They also dropped triglycerides from 353 down to 196. The way to do it effectively and long term is with a high carbohydrate diet and exercise. Next slide. Go on to the next slide. The mechanism for short-term weight loss on these programs, they do work. You do lose weight, your friends lose weight following these kinds of diets, and they work in two ways, the high-protein diets. And so I'd like to separate them for a moment into two categories. One of the diets like Atkins and Protein Power that work by making you sick and you lose weight. Now let me tell you how they work. They reduce your carbohydrate intake to the point where you go into ketosis. And you check your urine to make sure there are ketones in your urine. Now, ketosis occurs in two other natural circumstances. One is if you're starving to death. It's one of the kindnesses of our Creator, so that when people starve to death, which they have done many times in history, it only hurts terrible for the first 3 days. And then ketosis sets in, and the pain of dying of hunger is much reduced. The other time that you go into ketosis is when you're seriously sick, because you should not be gathering and preparing foods. Instead, you should be recuperating. So that's one of the reasons I call these diets the make yourself sick diets. The other reason I call them the make yourself sick diets is they recommend the very foods that the Heart Association and the Cancer Society give you the most serious diseases we suffer from in this country. You can lose weight many ways, but there's only one way to lose weight and be healthy. Let me tell you a great program for losing weight. It's called cancer chemotherapy. You lose weight, your blood pressure comes down, your triglycerides come down, your cholesterol comes down, your insulin levels come down. Yes, you do. But nobody would declare that a healthy way to lose weight. And you will lose weight on the Atkins and the Protein Power diet, but you will not become healthy. You'll lose it by becoming sick. Now, the other way that these diets work, and any of you who want a thorough explanation of this, you go to my website and you read a debate I did with the fellow who developed the Zone, Barry Sears. And you'll read in that debate on how I showed in front of 4,000 people in Las Vegas how he cannot and does not follow his own diet. It's scientifically impossible. Mathematically cannot be done. So what these kinds of diets do, like the Heller's diet, the Carbohydrate Addicts diet, and the Zone diet, is what they do is they invent rules that trick you into reducing your calorie intake. That's all they do. There's nothing magic about insulin levels or eicosanoids or any other little gimmick that they're trying to sell you. Next slide. Goal number 2 is to avoid a tragedy. The biggest tragedy facing people in this room is a heart attack. 1.25 million people will suffer a heart attack in the United States this year. Half of them that have heart attacks will die within 24 hours, and half the people who get heart attacks never knew they were sick. But there are other problems of the body that are caused by the same mechanism that gives you heart attacks. Next slide. Next slide. Yeah. Arteries throughout the body get diseased, and when the blood flow gets compromised to an organ, we name the disease. For example, if you compromise the blood supply to the ears, the inner ears, you get hearing loss. If you compromise the blood supply to the brain, you get a stroke. If you close off the arteries to the heart, a piece of heart muscle dies and you have a heart attack. You close off the arteries to the kidneys, you get kidney failure. Close off the arteries to the back and you get back pain. And you close them off long enough and you get degenerative disc disease and you rupture a disc. They call it degenerative disc disease because the discs have degenerated. They're so weak, a slight twist ruptures them. People who rupture discs do not do it by picking up pianos. They do it by slight motions because the disc is degenerated due to an insufficient supply of nutrients because of diseased arteries to the back. You close off the arteries to the legs, and it hurts when you walk. You get something called intermittent claudication. You close them off really seriously, and the feet die. You have gangrene. You close off the arteries to the penis, and you become impotent. It's not because men lose interest in women. It's because of a serious artery blockage. Next slide. Just go on to the next slide. I want to talk to you about the mechanisms involved in closing off these arteries, because I think it's important for you to understand the underlying mechanism, because it'll explain all kinds of mysteries to you. To close down an artery, you have to do two things, and these two things are really intertwined because the same diet and lifestyle causes both of them to happen. One thing you have to do is damage the artery and cause a condition known as atherosclerosis. The second thing you have to do is you have to close down the artery completely with a blood clot, and that blood clot is called a thrombus. What happens is the inside lining of the arteries, they get injured. They get injured by products of cigarette smoke combustion, by dairy proteins that are antibodies directed to dairy proteins that also find similar sites on the artery wall, by oxidized cholesterol, which you get in your food. And the inside lining of the artery has a very thin skin called the intima. It gets injured, and once injured, it becomes permeable. And now cholesterol and fat can leak under that skin and cause festering sores. It'd be similar to getting a sliver of wood stuck under your skin in your hand. You get redness and swelling, then pus would develop, and then eventually scar tissue would set in. But you'd never let that happen because it would hurt. And so you'd reach down with your tweezers and pull the sliver out. The problem with the arteries is they have no nerves. And so slivers of cholesterol and globs of fat get stuck under the skin and cause these festering sores, and we take no action because we can't feel anything. Now, these are festering sores. They've got white blood cells. They've got all the components of a festering sore. We don't call them festering sores, I think in part because if we did, it might scare you. And you might want to know what causes it. You might want to do something about it. Instead, we call these plaques. Who knows what a plaque is? Couldn't possibly be anything bad. It's such an innocuous word. But these are actually festering sores. Now, the way you get into the final act of trouble, the way you completely close down the artery, is different than you may have thought. I used to believe, no doctor today does, but I used to believe that what happened is one of these sores, let's call it a plaque now, one of these plaques will grow bigger and bigger and bigger and bigger and close off the artery. Makes sense, doesn't it? But that's rarely what happens. What almost always happens is a tiny little sore develops a crack in the surface. Let me say that again. A tiny plaque develops a crack in the surface, and the inner contents of semi-liquid necrotic material come spurting out of that plaque like a pimple rupturing on a teenager's face. That act of rupture acts as a catalyst that causes the blood to clot. Now, why would you want to know all this? Well, it explains all kinds of things to you. It explains to you why people who are, quote, perfectly healthy drop dead of heart disease. You go to bed at night, everything's fine, you wake up the next morning, you shake your spouse, and he's not there. Well, he was perfectly fine when I put him to bed last night. No, he wasn't. He had all these little landmines located throughout his arteries ready to burst. And these little landmines, they never cause any problem because they're so tiny they don't cause chest pain. But they're volatile plaques. This mechanism is so common to happen that in every hospital in the country you can interchange the name heart attack with coronary artery thrombosis, which is the mechanism that causes the blood clot. This is how a heart attack occurs in almost every case. Now, the other reason you might want to know this mechanism is because it will explain to you why bypass surgery does not save lives in most cases. Bypass surgery bypasses a large plaque, one that's very stable, full of scar tissue. And so it brings new circulation to the area of large blockage, and that may relieve chest pain. But bypass surgery does nothing to the little tiny plaque over here that's ready to rupture, or the one in the next artery that's ready to rupture, does it? The lesions that are the culprit lesions, we call them, the ones that are the lethal lesions, bypass surgery doesn't even touch. As a matter of fact, to add insult to injury, in every hospital I have ever been in, the patient who survives bypass surgery is rewarded with the very foods that brought them there. They get bacon and eggs for breakfast and pork chops for dinner. Understanding this mechanism explains why angioplasty has never been shown to save lives. Bypass, there's few percentage of patients in subcategories that it shows survival benefit. But in angioplasty, they've never been shown to save lives with that procedure. That's where you take the catheter, you run it up the leg into the main big artery and then into the coronary arteries. And once you're in the heart arteries, they blow up a balloon and squash the plaque, or they cut it with a laser or a knife. Well, one of the reasons that it's not been shown to save lives is that all this trauma in the area of the plaque, due to the balloon or the knife, acts as a catalyst that causes the blood to clot. And so the statistics tell us that within 5 months, 40 to 50% of the arteries so treated are completely closed down. Understanding this mechanism, you know how aspirin reduces the risk of dying of heart disease, and it does. It's a wonder drug for people who have a history of heart disease. And I prescribe it to my patients who've had a heart attack, bypass surgery, or angioplasty only. If you haven't had those indications, then your risk from aspirin are greater than the benefits. Aspirin in small amounts, less than a baby aspirin a day, will cause the blood clotting elements, which are known as platelets, to become inactive. And as a result, when this plaque ruptures, the blood clot is less likely to form because you've thinned the blood. Vegetable fats do the same thing. They will thin the blood so that when the plaque ruptures, you're less likely to get the blood clot forming. But taking vegetable fats is not a healthy way to thin your blood. The healthy way to thin your blood is to remove the strongest clotting factor human beings come in contact with, and that's animal fat. Animal fat makes the platelets very adhesive. They can hardly wait to stick together. It makes your blood clotting proteins, we call these blood clotting factors, very active. They can hardly wait to spill over into that clot. So taking the animal fat out safely, naturally, thins the blood. And that's how within hours of changing your diet, you reduce your risk of dying of heart disease. Now in time, if you follow a healthy diet, you'll actually see reversal, where the plaques will become smaller. It doesn't happen to a great amount, and it's not really important whether it does or doesn't. But the plaques become stabilized, and you reduce your risk of dying of heart disease when you change to a healthy diet. And the blood reduces its risk of clotting. Now, studies done, and these are done by Dr. Dean Ornish, show that you will get reversal that you can detect by our crude methods in 82% of people at the end of a year. If you take drugs to lower cholesterol, your chance of seeing reversal is 16 to 30%. So always understand that the foundation to getting well is a healthy diet and exercise program, and then afterwards you use medications very judiciously. Next slide. Your cholesterol is a crystal ball, and you all should know what your cholesterol level is. Average cholesterol in this country is 210 to 220. If you're average, you're being compared with sick people, Americans. That means you have an average chance of dying of heart disease or a stroke, which is a 50% chance of dying prematurely of a heart attack or stroke. You don't want to be average. And you certainly don't want to be worse than average. You get up here in the 260, 270, 280 range, and that's suicide. What you want to be and what you want to ask your doctor or the scientific literature is, what level can I be at where my risk is 0 or close to 0? Where am I immune from dying of heart disease? And that level has been determined, and that's a cholesterol of less than 150. And all of you can get there by use of a no cholesterol, low fat diet and judicious use of cholesterol lowering medication when necessary. A drop in cholesterol of 60 points reduces the risk of dying of heart disease by 5-fold. In studies, some studies done, people who showed reversal had about a 60-point drop in cholesterol. Next slide. So what can we accomplish with diet alone? This is a group of 1,250 people, very significant data. And we see here that we have initial cholesterol in patients of 219. In 5 days, it drops 15 points. That's 3 milligrams per day. And finally, they're at, what does that say, 190? Yeah, 190. At 11 days through dietary change alone. One of the things I alluded to a little earlier when we talked was that doctors enjoy practicing medicine because they get a chance to help people. And I have to tell you, I'm the luckiest doctor in the world because I get to help so many people. And I have to tell you something else. The sicker you are, the happier you make me. Because people who have the worst problems have the greatest margin for improvement, and so you see the greatest benefits at the end of 12 days. You know, people come to me very despondent with bags full of drugs and a horrible history of multiple surgeries and hospitalizations, and I say, rejoice! You're going to be the star pupil. And they always are. Next slide. So it is with cholesterol. You see the average drop is 29 points, but if you started with a cholesterol less than 200, the average drop is 16 points. If your cholesterol is 200 to 250, the average drop is 29 points. If your cholesterol was 250 to 300, in less than 2 weeks you drop your cholesterol 41 points, and if your cholesterol started at over 300, then in less time than you take for a summer vacation, your cholesterol drops 65 points with diet alone. Next slide. People will also argue with you that eating a high-carbohydrate diet makes your triglycerides, that's the fat in your blood, go up. That's only if you design your experiment incorrectly. Correctly from their point of view, but incorrectly according to nature. What you have to do to get the triglycerides to go up is you have to feed lots of simple sugars, lots of refined foods, and you have to make your patients eat beyond their level of comfort. They have to overeat, and then you make the triglycerides go up. But under natural circumstances, like we have in the clinic, the average drop in triglycerides is 10 points in 11 days, and if you started with high triglycerides, say over 600, the average drop is 311 points in 11 days. Next slide. I use cholesterol-lowering medications. I start out with the, quote, natural ones, which are garlic, which lowers cholesterol 9%. Vitamin C drops at about 10 to 15%. Dietary fiber, like oat bran or oatmeal, drops at about 5%. Vitamin E will drop at 10, 15, 20%. Gugu lipid, which you buy in the natural food store, will drop at 21% in 3 weeks. Activated charcoal works as well, if not better, than some doctor-prescribed medications known as cholesterol binding resins like Cholestid and Questran. And then there's niacin. Niacin lowers cholesterol too. But you have to be very careful because niacin can be toxic, particularly in its time-released form. In the time-released form, as many as 50% of patients develop a chemical hepatitis. So if you're going to take niacin, take it in the immediate released form and take it under supervision because you could get into trouble. Then after these medications, I go on and use a class of drugs called the statins, like Mevacor, Zocor, Lescol. They're very, very effective drugs, and I believe they're beneficial, and in most cases, the benefit outweighs the risk. Next slide. We also cause people to lower their blood pressure. The average blood pressure in our patients when they come in is 132 over 80. At 11 days, it's 125 over 75. In other words, they drop their blood pressure 7 over 5 millimeters of mercury. But there are a couple of things you need to know about this. First of all, the drop doesn't take 11 days. It usually happens in 24 to 48 hours. And the other thing you need to know is that I took almost every one of the patients the first day off all of their blood pressure medication. Unless they're on just bags full of medicine or they were on beta blockers, which I stopped slowly over 3 to 6 days. I took them off all their medicines the first day they saw me. And yet still you see those kinds of drops in blood pressures. Next slide. The sicker you are, the happier I am. If you start with a high blood pressure, say 150 over 90 or greater, and the average here was 171 over 101, the average drop is down to 148 over 87, or a 23 over 14 millimeter drop in blood pressure, and I took them off their medications in almost every case. Next slide. How can something like this happen so dramatically? It's because big changes beget big results, and I put it through big changes. For one thing, what I do is I decrease the activity of their heart, and I do that by taking them out of their stressful environment, and I take their coffee away from them. Coffee is a big deal. Coffee and tea are a real big deal when it comes to blood pressure for many people. It could be the sole source of their problem. I decrease their blood volume by reducing the sodium and increasing the potassium on this high vegetable diet. And the third thing I do is I reduce peripheral resistance. Peripheral resistance. To understand peripheral resistance, remember last time you were watering flowers? You decided to water a flower 20 feet away and you didn't want to walk over there, so you put your thumb over the end of the hose, increased the resistance to flow, and the pressure went up and you squirted the flower. Well, the reason people have high blood pressure in our society is primarily because of increased peripheral resistance. Because all their little hoses are being squeezed. Their little blood vessels are being squeezed by atherosclerosis, which makes blockages, by spasms in the arterial walls caused by the foods that we eat, and by a sludging phenomenon that occurs as a consequence of the fats that we eat. Next slide. If you set up an experiment where you take and you look at the whites of a person's eyes, and you take pictures, the picture on your left shows a rich blood flow, very thick vessels, lots of blood vessels. And then this 44-year-old fireman is fed one meal that contains 67% of the calories as fat. Typical of a meal I used to eat: 2 eggs, 4 strips of bacon, milk, cream, 2 pats of butter. Nothing unusual for me as a young man to have for breakfast. After one meal, they took a picture of his eye 4 hours later, and you see the dramatic reduction in circulation. There are vessels there that you see in the left frame that you don't see in the right. And the reason is that the only reason you can see vessel walls is because of opaque red blood cells flowing through these transparent walls. When the opaque red blood cells no longer flow through, then you can't see the vessel. Could I have a video? What I'm going to try to show you is a dramatic representation of what takes place. When you eat fat, this is fish fat, cow fat, flaxseed oil fat, olive fat, pig fat, I don't care what kind of fat. When you eat fat, what happens is it goes into your gut, through your bloodstream, and then it coats your cells. How are we doing here? Here you see the flow of blood prior to any meal. The cells have a natural tendency to repel each other. The cell membranes repel. As a consequence, you have easy flow. This is a larger blood vessel, so you have even more flow. You feed the fat. The fat coats the blood cells. Now they can no longer repel. Instead, they hit, stick, clump, sludge. They form what we call rouleau formation. There are cells there that you see that are white. They're called ghost cells. They've been so long from the lungs, they've lost all their oxygen. If you measure the oxygen content of a person's blood pre- and post-meal, you see a 20% drop in oxygen content. Blood cells become rigid. Prior to the meal, they will bend in half and fit through a capillary half the size of a single cell. After they've been coated with fat and lost their oxygen, they're stiff and they won't fit through the capillaries. You can turn it off now. Finally, after 8 to 10 hours, the sludging starts to break up. Now, what are the consequences of this sludging phenomena? Well, in simple terms, it explains to you why you get tired, or used to get tired, after you ate a meal. If I had a test or an important meeting in the afternoon, I wouldn't eat lunch because I knew I'd be sleepy and sluggish. In terms of more serious things, if you sludge that whole system, you create tremendous peripheral resistance and the blood pressure goes up. When you change your diet, the reason I have to take people off of their blood pressure medication quickly is because this whole bed of circulation opens up. And if I don't take them off the medicine quickly, they'll fall over in their mashed potatoes. When people have chest pain with narrowed heart arteries, it's been shown for 100 years that if you take people and you feed them different meals, that they get chest pain after you feed them high-fat meals. And it's not because of more digestion that goes on with the meal, it's because of the fat. And if you take the fat out of the diet and put them on a healthy diet like I recommend, you get a 90 to 100% decrease in frequency of chest pain episodes in less than 3 weeks. And it's the same diet that reverses the underlying disease. Now, do you tell me why a person with heart disease and chest pain who goes to the doctor is offered a handful of pills and a bunch of surgery before they're offered a healthy diet? I don't get it. Next slide. Goal number 3 is to delay deterioration, and the most deteriorating disease I know is diabetes. We talked about type 1 diabetes before. Let's talk about type 2 now. Type 2 diabetes is where you have as much insulin as somebody without diabetes and often twice as much insulin. Just the insulin doesn't work. It doesn't work because of insulin resistance and other factors. Next slide. There's an island that is, let's see, where is that? 5,500 miles southwest here. It's called Nauru. And on that island lived Polynesian people who enjoyed excellent health at the beginning of the last century. Then, prior to World War II, their health changed. What they discovered on the island was a natural resource known as bird dung. And they exported the bird dung for its phosphates and nitrates and became known as the richest nation in the world. They changed their diet of taro and breadfruit and potatoes and vegetables and little bits of fish to a diet they imported from Australia and New Zealand. If you read about these people, like in this National Geographic article in 1976, you will find that these people often consume 4 different kinds of meat at a single meal, kind of like a submarine sandwich or a Colossus burger. Well, they developed a population where in 1976, 1/3 of the people over the age of 15 had diabetes. If you go there today, 40% of the population has diabetes, but you don't have to go to Nauru to see this. You can go to Tucson, Arizona. 50% of the Pima Indians have diabetes. Go to Hawaii. 40% of the Hawaiians have diabetes. Go to some cultures of Hispanics and blacks, 20% have diabetes. Somewhat, yeah, it's related to race, yeah. But I have to point out to you that none of these Indian or Polynesian groups had diabetes before they changed their diet. They were trim, they didn't have heart disease. But it's also related to some cultural issues too. Any of you who are in the health business know that the fattest and sickest people you have in your practice are the least privileged people. Isn't that sad? In addition to the other burdens they have the exaggerated burden of the rich American diet. And so as a result, they are the fattest and sickest people. 50 years ago in this country, the fat people were the rich people. And the poor people who couldn't afford to buy rich food were trim and healthy. Now, the rich people who are generally better educated, they learned about exercise and quitting smoking, eating a healthy diet. And so the rich people have gotten thin. Now, the poor people, they're not so poor anymore. They have subsistence programs, they have better opportunities for jobs, but they don't have the information. And as a consequence, they get doubly abused. If you'd like to develop diabetes, I'll show you how to do it. Next slide. Richard Sweeney did these experiments in 1927. You can do them today if you want. He took his healthy 20-year-old medical students. He fed them fat for 2 days and did glucose tolerance tests on him. Color isn't very true in this. But anything over 150 means diabetes based on a glucose tolerance test. After a high-fat meal, after high-fat meals for 2 days, all of his students developed diabetes, which are the lines over the 150. And then he fed these same students, he fed them a diet of carbohydrate. It's actually half sugar and half starch. And they tested the bottom 4 lines. In other words, they were all tested non-diabetic. And so what doctors knew back in the 1920s and good diabetic doctors know today is fat paralyzes insulin activity, including fish fat, olive fat, flaxseed oil fat, you name it fat. It all does it. And carbohydrate, even pure white sugar, makes insulin work better. Next slide. So what I'm trying to tell you is don't get suckered into believing that sugar causes obesity and diabetes. Now, sugar is not health food. It will rot your teeth. It will cause serious nutritional imbalances. It will make weight loss difficult. But it doesn't cause obesity and it doesn't cause diabetes. If sugar caused diabetes, you wouldn't see this next time you walked into a fast food restaurant. You wouldn't see that 100-pound overweight person in front of you walk up to the order counter and say, "Give me a double cheeseburger and a Diet Coke." The Diet Coke never saves them, does it? No, because it's not the problem. The problem is the richness of the diet. And the sugar is part of that richness, but the fat's even more of a serious burden on the body. And the refining of the food. So it's the rich American diet that causes this. Don't go blaming sugar, because you lose focus on what really the big problem is. It's the whole rich Western diet. Next slide. Okay, goal number 4 is to prevent a disaster. Cancer is the biggest disaster facing everybody in this room. If I was your doctor and I personally delivered a message of doom to you, the worst message I could deliver to you is you have cancer, or your spouse has cancer. Why? You know, it's just as cold to be lying in a coffin dead of heart disease as cancer. Why is cancer so scary? It's a dehumanizing disease. It's long suffering. It's deadly. And the treatments. The nice thing is that over 90% of cancers we know are caused by our diet and lifestyle. So we can prevent cancer. That's how we win the war on cancer. Next slide. I'm going to talk to you about breast cancer. It happens to be my favorite cancer for a whole bunch of reasons. Well, I've been personally touched by breast cancer. I lost my aunt 30 years ago to breast cancer at age 50. And this past November, my brother, who's an internist, lost his 30-year-old wife to breast cancer, and she left 2 young children, age 5 and 7. So it's touched me many times in my life. 30 years ago, 1 in 20 women in this country got breast cancer. When I first became passionate about it about 20 years ago, 1 in 14 women developed breast cancer. You may be familiar with the figure of 1 in 10, but actually the figure that is given by the American Cancer Society is 1 in 8 women in this country develop breast cancer unless you happen to be rich. If you live in a wealthy community, the risk is 1 in 7. I think you'll hear figures very soon that 1 in 5 women will develop breast cancer. Yeah. It's becoming a more common disease and also more common in younger women. I mean, in my early training, if I saw a woman 50 with breast cancer, she was a young woman. Now I see monthly women in their 20s, like my sister-in-law, with breast cancer. It's the most common cause of death in women middle age and beyond. And if you don't like me talking about breast cancer, every time I say breast, you can say prostate. Prostate cancer is the same cancer in men that breast is in women. Next slide. Now that's in the United States. In other parts of the world, breast cancer is less common. For example, in Japan, it's 1/4 to 1/7 as common as it is in the United States. Well, the Japanese eat a lot less fat. If you double the fat intake of the Japanese and you look at the Italians who eat all that health food olive oil, you see they have twice the chance of getting breast cancer. Now double that fat intake again and look at the United States who eat 4 times the fat as the Japanese, they have 4 times the breast cancer. But it's not right to say fat causes breast cancer. You're missing the big picture. It's like saying sugar causes diabetes or obesity. It's a much bigger picture than that. You know, fat's part of it. Fat suppresses the immune system, particularly vegetable fats. I mean, they really lower the immune system, like safflower oil, corn oil, flaxseed oil. Why do I keep saying that flaxseed oil stuff? But there's more to it than that. There are fats in our diet that are called trans fats. These are synthetic fats, and when they get incorporated in the cell wall, they leave big gaping holes where cancer-causing chemicals can get into the nucleus, where it damages the nucleus of the cell. Animal protein suppresses the immune system. More calories encourage cancer, and of course, high-fat diets are higher in calories for the reasons we talked about. Environmental contaminants damage the cell nucleus, promote cancer by their estrogen effects. You know, dioxin, which we're going to talk about in a minute. Dioxin not only damages the nuclei, but also acts as an estrogen. And do you know that 90% of the dioxin that you take in, not you, but other people, the average American, 90% of the dioxin comes from meat and dairy. Yeah. Why? Because we eat high on the food chain when we eat those products. You see there's a little bit of dioxin here on the plants, okay? The cow comes and eats all the plants, tons of plants, all that dioxin's concentrated in the fat because it's fat soluble. And then we eat a few hundred pounds of cow fat, and it's all concentrated in our body fat. That's how we get it. So the way to protect yourself from these environmental contaminants, eat low on the food chain. Now, the rich Western diet hurts you in other ways. It doesn't give you the things you need to prevent and reverse cancer, like dietary fiber, which binds and deactivates cancer-causing chemicals. Fiber is only present in plants. There's no fiber in any animal product. Antioxidants. Beta-carotene is only present in plants. C is only present in plants, and almost all your E comes from plants. There's a whole group of phytochemicals that you've heard some about. You're going to hear even more about. These phytochemicals are in plants. Phyto, plant, chemicals. And there are thousands of them. A few have been discovered. They're in all the plants. Don't go focusing on soy as your sole source of phytoestrogen, or clover, or any specific food. They're all over the plant kingdom. They're in all the plants. Now, some of them are more concentrated, have been isolated, have been sold to you as pills for their benefits. And you've been focused on certain foods like soy foods to get them. That's the wrong focus. You should be focusing on starches, vegetables, and fruits. You're sure you can have some soy products. Probably not a lot, but some soy products. These phytoestrogens, the way they work is they get into your cells, and they stimulate your cells in a way, by a reflex mechanism, they lower your body's production of estrogen, and they also occupy the cell site so that your stronger estrogens can't get in there and have an effect. The stronger estrogens made in your ovaries. So that way it reduces your risk of hormone-dependent cancers like breast, uterus, ovary when you're young. But they do you a double good service because when you get old, they give you an estrogen effect. They stimulate those cells and give you an estrogen effect. So as a result, women who eat a healthy diet don't dread menopause as a disease as women do in our society. In fact, there's no word for hot flash in the Japanese language. Next slide. You look at this data and you say to me, I'm not being fair. I'm comparing Japanese women with primarily white women in this country. Japanese women are smaller with smaller breasts. Maybe that's why they get less breast cancer, you say. Well, let's take a look at what happens when Japanese people change the way they eat. The first bar represents the chance of getting breast cancer in Japan. You move that lady to Hawaii, study her in 1963 when fast food was a Simon stand, and yet she's almost doubled her chance of getting breast cancer. Now you look at her in 1974 in San Francisco. She's been fully westernized. She has the exact same chance of getting breast cancer as a white woman. This has nothing to do with race. This has everything to do with the 1 to 5 pounds of environment we take in as breakfast, lunch, and dinner. Next slide. In the country of Japan, diet has changed also. Post-World War II, we taught them the American way. We sent them our fast food restaurants. They learned well, and so between 1955 and 1975, you see an increase in fat intake, increase in animal protein intake, and a decrease in rice and vegetable intake. Next slide. In that same time period, they doubled the chance of getting breast cancer in Japan. In Singapore, the chance of getting breast cancer doubled between 1970 and 1990. As of this year, it is supposed to have tripled. Every place you look in the world, as people adopt this wonderful diet of rich people, they get fat and sick. Next slide. We've been doing experiments since the 1930s where you feed fats to animals and they develop cancers. High-fat diets, you get many cancers. Low-fat diets, few cancers. If you want to grow cancer in your animals, the best fats to feed them are safflower and corn oil. Not quite as good, but they still do cause cancer in your animals, promote cancer, are your lards and olive oils. The least effective at promoting cancer in most experiments are your omega-3s that are found in fish and flaxseed. But I caution you, these omega-3 fats can be cancer-promoting under the right experimental circumstances that do exist in natural living conditions. So the most safe message I can offer you is to treat all free fats the same way. They are toxic to the system. At the very least, the fat you eat is the fat you wear. They will sludge your blood, and they will paralyze your insulin. Next slide. Now, there's a connection between diet and hormones and cancer. We all know this. Breast cancer, prostate cancer are tied to our hormones. We know it in women because women get breast cancer 100 times more than men. Women who lose their ovaries early in life have a much reduced chance of getting breast cancer, and if you take hormones, you increase your risk of getting breast cancer by 50% over a 5-year period of time. So there's a connection between diet and hormones and cancer. Now, where's that connection between diet and hormones come from? Well, this was discovered, next slide, when historians looked at the onset of maturity of children. And this has been thoroughly studied in many countries like Norway, Germany, Finland, Sweden, England, the United States. What they have discovered, based upon menarche, which is the first menstrual period of a little girls become women, capable of reproduction when they start to bleed. And so this particular time in life has been thoroughly studied and recorded. And what historians have discovered is that the average onset of maturity based upon menarche was 17 to 18 years of age, back in the early part of the 18th century. As nations became more industrialized and people ate more affluent diets, the onset of maturity has decreased 2 to 6 months per decade to where now the average onset of maturity of a little girl is age 12. The highest onset of maturity that I've ever read about is in Papua New Guinea, where the average onset of menarche was age 19 in the 1960s. Again, they eat pure vegetarian, low-fat diet, except for a few bugs. Next slide. Let's take a look at Japan, which has recently changed their diet. Back in 1875, the little girl started her period at 16 and a half, almost 17 years of age. Right after the war, she started her period at, let's see, it's 14.2 years of age, or 15.2. And then by 1960, she was starting her period around 14 years of age. And by 1970, she was starting her period at age 12. That's just over the last 50 years, we see that decrease in onset of maturity in Japan. Now, there's another way of looking at maturity of little girls. And by the way, this same thing happens in boys. It's just not as dramatically observed. Another way of looking at onset of maturity is based upon puberty. Puberty is defined as the development of axillary and pubic hair and breast buds. A large study was published in April of 1997 in Pediatrics, where doctors all across the eastern part of the United States surveyed little girls and noted the onset of puberty. And what they found was the average onset of puberty of little white girls in this country is 10. The average onset of puberty of little black girls in this country is 9. 3% of black children in this country, black girls, are maturing at age 3. 50% are maturing at age 8 of little black girls in this country. What we have done is we've stolen our children's childhood with the rich Western diet. They're maturing 5 to 7 years before intended. So what happens when you give a child feelings that we as adults can hardly deal with? Sexual urges, capabilities of reproduction. What happens? Next slide. Well, you cause social chaos is what you do. You have class romantics, acts of bravado, as a dangerous stunts as a consequence of showing their macho hormones, right? Kids do that. You have earlier initiation of sex, earlier pregnancy, younger contact with sexually transmitted disease, and you invite sexual abuse of children. You see, this is a real problem. You take little girls, 7, 8, 9 years old, and you develop their buttocks and their breasts, and what happens with men and boys? Very naturally, they're attracted. And age should, but sometimes doesn't come into that discussion. And so little girls, 7, 8, 9 years old, are defenseless. Earlier marriage, higher divorce rates, greater chance of single motherhood, disruption of mother's education, more poverty, greater pregnancy complications, more low birth weight deliveries. Yeah. And physical changes too. The consequence of early maturation is you end up shorter. My son, who hopefully I'll be windsurfing with tomorrow, is 25 years old and 3 inches taller than I am. My daughter is an inch taller than my wife, and they matured later in life. You have more breast and uterine cancer, lower survival rates, and more heart disease when you mature children earlier. And then we have that old thing about teenage pregnancy, right? Every 26 seconds, a U.S. teenager becomes pregnant, and every hour, 56 children give birth to children. Yet we're going to solve it with a social program. Yes, we are. We're going to make all those hormones go away. I hear about it on TV and radio all the time, and I would laugh if it wasn't so serious. But you as families can determine when your children mature, and it's very important. I'm sure you've thought about it, and you dread the idea of having to deal with these kinds of urges in 7, 8, 9-year-old children. I mean, when kids are 11, 12, 13 years old, they're supposed to be playing checkers and doing their homework, not thinking about the opposite sex. And you can stop that if you want by changing your child's diet and give them back their childhood. Let them mature at 18, 19 when it's time to procreate. Next slide. All right, those hormones, where do they come from? They come from chemicals in the environment, like I told you, dioxins, DDE, which is a breakdown product of DDT. Body fat, the fatter you are, the more hormones you make, because all your little fat cells are factories to make hormones. Bile acids that you make to digest fat are converted in the large intestine when you grow unhealthy bacteria into sex hormones. So the more fat you eat, the more bile acids you make. The more you eat the American diet, the more you make these bacteria that convert the acids. And you also grow bacteria in your colon that recirculate your hormones. You make estrogen in your ovaries, your body fat. It's supposed to go one time through the body, affect your breasts, your uterus, your skin. And then it goes to the liver, and it's drawn out of the blood into the liver, where it's conjugated with another substance and secreted through the bile into the bowel, where it's supposed to leave the body. But when you eat the rich Western diet, you grow bacteria that break up this conjugation, free that estrogen up. Now it's recirculated through the body. Why do we know this? Well, you examine women who eat like we do, and they have 4 times as much estrogen in their stool as women that eat the rich Western diet. It leaves like it's supposed to. And then you measure the biologic activity of estrogen in a person's diet, and this is what you find. Here's the day a woman's born. And here's the day she dies 80 years later. On a rich diet, her estrogen levels go up quickly. She matures at, say, 10 years old. Throughout life, she has exaggerated levels of estrogen. She menopauses at 50. On a healthy diet, maybe she matures at 16, has 50% lower estrogen stimulation, and menopauses 2 years early. What is the consequence of this higher exaggerated estrogen level and prolonged stimulation? It's disease. You overstimulate the breasts, you get lumps and bumps and tender breasts. It's known as fibrocystic breast disease. You promote breast cancer. You overstimulate the uterus, and the inside lining of the uterus grows too thick every month. Your endometrium grows as a consequence of estrogen stimulation. So when you overstimulate it, it grows too thick, so when you shed it at the end of the month, you lose more tissue, more blood, more iron. You have more clots, more pain. Some women, this bleeding gets so bad that they call it dysfunctional uterine bleeding or abnormal uterine bleeding. They bleed real heavy at menstrual time and sometimes mid-cycle. And for that reason, many women get a hysterectomy. The endometrial tissue breaks down into cancer, and if that happens, you will get a hysterectomy. But the most common reason for a hysterectomy is fibroids. These are non-cancerous lumps in the muscle part of the uterus that are the size of golf balls to the size of basketballs. And they grow as a consequence of stimulation of the smooth muscle cells by estrogen. Now, if you change your diet, what happens is the estrogen levels plummet, and the breast tenderness goes away in essentially 100% of cases. Within 6 months, 60% of the women have resolved their lumps. The menstrual periods become lighter in the amount of bleed. They become shorter in the number of days of bleed, and they become further apart in the cycle. The fibroids do not disappear as far as I know. But getting rid of fibroids is often just a matter of waiting until you go through menopause, and then they shrink away as your ovaries reduce the production of estrogen. Next slide. Next slide. See, I was almost perfect today. I got one slide mixed up. Oh, well. The diseases caused by the rich Western diet are hardening of the arteries, which leads to heart attacks and strokes, high blood pressure, adult diabetes, obesity, arthritis, including ankylosing spondylitis, gout, psoriatic arthritis, rheumatoid, lupus, osteoporosis, kidney failure, kidney stones, multiple sclerosis, all kinds of bowel diseases like appendicitis, constipation. You know, every one of my patients at my clinic at St. Helena Hospital knows what causes constipation after the second day. And in fact, many of them tell me they think about me at 3 o'clock in the morning. Colitis, including Crohn's, ulcerative colitis, nonspecific, chronic diarrhea, diverticulosis, diverticulitis, gastritis, gallstones, hiatus, hernia, hemorrhoids, and varicose veins, all caused by the rich Western diet, along with a whole slew of cancers. Now, for a lot of people, this is difficult to believe, and for even more people, this is a threat. People don't like to hear that the rich Western diet caused them all these problems. And they don't want to hear the way Mama taught them how to make meatloaf was killing them, or the way what they're going to have lunch with their friends tomorrow is going to lead to heart disease. People don't like to hear that. And so at this stage of the game, I like to tell people I have not been talking about the diet that I used to eat and that you used to eat, and most of your friends still do eat. I've been talking about the diet of a whole other group of people. Can you back up one slide? I've been talking about the diet of these people. This is a picture painted by Gilray 200 years ago. He tells the whole story. You can tell the social class of these people. You can tell their health. The man who is so thin there has a wasting disease. Could be easily diabetes. The lady holding her stomach has the colic. And you know what's wrong with the fat fella? Rich foods make people sick. They did 200 years ago. They do today. They will 200 years from now. Then 2 slides in advance, please. Now, the treatment that I use is no new invention. It's an approach that's been used for thousands of years that I know of. For example, the reference from Daniel, 600 BC. He's talking to his own overseer, and he says, please test your servants for 10 days. Give us nothing but vegetables to eat and water to drink, then compare our appearance with that of the young men who ate the royal food, and treat your servants in accordance with what you see. Now, admittedly, it is not a double-blind, placebo-controlled experiment, but it has survived the test of time and observation and good judgment. So he agreed to this, and he tested them for 10 days. At the end of 10 days, they looked healthier and better nourished than any of the young men who ate the royal food. This is truth. Next slide. Dietary change is powerful medicine. If you're sick on medication, seriously ill, you need to see a doctor to help you. Particularly if you're on blood pressure and diabetic pills, if you change your diet without proper advice, you could end up with problems. Now, if you're just a little fat, a little constipated, a little headachy, a little arthritic, like most people in this country, change your diet right now if you haven't already, because this is the diet you were supposed to eat ever since you got off mommy's breast. This is the diet for human beings. Thank you. We have about 10 minutes for questions.
Yes. And just to make it a little more efficient, I will be up here where we were yesterday with Dr. John Lee. If you have a question for Dr. McDougall, let's limit it to 10 people. Please get in line. Some are sprinting. And we'll hand you a question, and you can ask your question of Dr. McDougall.
Do you have a mic for them? Okay. You want to come on up here and ask your question?
Doctor, my wife and I have a health food store in Northern California. We're getting lots of reports on little boys. They're not dropping their testes. It is our opinion that it's from the dairy, the estrogen. What is your comment on that, sir?
Okay, I think I heard the question is little boys are not dropping their testicles. They're also getting hypospadia. And the sperm count in men has dropped by about 2/3. And yes, I believe it's from the environmental estrogens. And they do also come from dairy. That's another source because they milk pregnant cows. And so that delivers high levels of estrone. And so milk is a very estrogenic substance in addition to the other ones that I showed you.
Second question, birthing. Since we have this underclass society that's getting pregnant in their teens, I'd like to elaborate on the calcium deficiency and what's happening to these premature babies resulting from the birthing before the mother can come to a full nutrition.
The question is young women having children, does this affect their calcium balance and the strength of the bones? You probably know more about that than I do. I was not aware that it was an issue, but I mean, there's enough problems associated with teenage pregnancies. Yes?
I just have one question. I didn't understand on the fats about seeds and avocados and that type of thing in the diet.
Okay, nuts, seeds, avocados, olives are high-fat plant foods. And I consider them delicacies. I've always thought of these as delicacies. And I think that's the way they should be consumed. They are in a natural environment. with antioxidants, phytochemicals, fibers, vitamins, minerals, and so on, where these fats are protected from rancidity and other changes that make them toxic. But they will make you fat if you eat enough of them. I think the reason that God put nuts in hard shells is so you can only eat as many as you can open with your bare hands. Yes?
What would you recommend for a female 52-year-old who is recently diagnosed with having cancer in and around both kidneys and has over the past 8 weeks dropped in her hemoglobin count from 8.2 to 6.9, currently has come up to 7.3 and has lost 50 pounds over the last 6 months?
That would be an impossible question for me to answer. You know, she certainly needs a good diet and she needs the best of medical care. The other thing you want to do is, can somebody flip the slide, one more slide over? Anybody know how to do that? Yeah, there's a website. There's my website right there and my email. On my website is a link to the National Library of Medicine if you don't know how else to get there. And every step of the way, every day I'd be in the National Library of Medicine investigating every treatment any doctor offered to make sure the benefits outweighed the risks.
Dr. McDougall, thank you very much. You gave me my life back in 1991 through listening to your program that used to be on the radio. My husband has muscular dystrophy, scapuloperoneal, and limb girdle. And do you have any thoughts on what might help him?
I don't know the diet would have any benefit other than it would for any other human being. Nothing special. This is a lady who was dying of asthma. That was her problem. She doesn't have any more. And the pharmaceutical industry is mad at you because you gave up all those pills. Yes?
Are omega-3 and 6 good for you, or to take?
Omega-3 and omega-6 I would not recommend to people for the reasons that I mentioned.
Okay.
You get them in the food. All of your essential fats are made by plants.
Okay, you can crush your own seeds and eat some of that?
Yeah, but why not get it from oatmeal? I mean, you can do that. It's okay.
Well, I was thinking of putting it on oatmeal.
But oatmeal has it. Bananas, oranges, potatoes, corn. I mean, they all have these fats. Plants make essential fats. The only reason an animal would have an omega-3 and omega-6 fat is because it ate a plant and stored that fat. No animal makes essential fats. So go to the plants to get it. It's just like plants make all of the essential amino acids. No animal makes it. Plants make the vitamins that we eat, all the vitamins except for D, which is not a vitamin, and B12, which is made by bacteria. You know, plants make all our essential ingredients. Do you think there might be a reason why? So as far as the nuts, I'd just be repeating myself over and over again. I mean, they're fine if you're not worried about getting fat. You can eat some nuts, but treat them as a delicacy.
Thank
you. If our government agencies are well aware, like the National Cancer Institute, that 90% of our problems were from diet, why isn't the educational program mandated both at the elementary and adult education to bring this message to the whole?
Okay, you know, let's just expand it. Why, if this is so well known, and I'm sure I'm not telling you anything that you haven't heard before, just maybe in a little different form, why isn't it the standard practice of medicine? Why isn't it mandated by every health insurance organization? Why isn't this part of every cafeteria in every school and in every place of business? You know, why isn't this what ought to be the norm? And it's too complex to give you a simple answer, but I think it has to do with money, surprise, surprise, and I think it has to do with egos. You see, this is simple stuff. I was told once by a doctor, a very famous professor in arthritis, when I congratulated him on his work with milk removal of dairy products and curing rheumatoid arthritis. He says, I don't want to be known for that anymore. He says, I'm now a professor in this very fancy medical school, and I don't want to be known as a doctor that deals with food. He said, you know, real doctors and researchers don't do that. I said, well, what do? He said, they deal in biochemistry and viruses. You see, so there's an ego thing there. I mean, for me to teach you about diet, you can teach people about diet. This is simple. This is, you know, dumb stuff. You got to be smart to do biochemistry and viruses. The other thing has to do with personal eating habits. Most legislatures, most doctors still eat the rich Western diet. Go to a Heart Association meeting. It's roast beef and cheesecake. So if I'm eating that kind of diet, how am I going to teach you any different? So a lot of things have to change, and they are changing. I told you about my work at Blue Cross, which is being expanded, because there's money involved. There's big money involved. And keep people healthy, this insurance company sees that they can make a ton of money. And that's why they want me. What they say is, you got one problem, and that's that V word. And I said, well, don't tell anybody about that. They actually did tell me that. They said, you know what they call you? They call you a vegetarian. I said, well, we can get over that. I'm making you a ton of money. You can get over it.
Do you recommend anything different for hypoglycemics?
No, I don't recommend anything different for hypoglycemics. If you go to this website, you'll see a section under common diseases on hypoglycemia. Hypoglycemia works similar to the diabetes thing I showed you. You get, what happens is it stabilizes your insulin and your blood sugar levels. The University of Kentucky says they use a similar diet. They've never seen a hypoglycemic that has not been cured with a high carbohydrate diet, ever. And they report that in their writings at their medical school. Yes.
2 questions. You talk about cholesterol, but you never mentioned the HDL-LDL ratio. What if you have
I know. It's too complicated for me.
But your HDL-LDL is gorgeous, below any risk?
It's too complicated for me.
Okay, how about...
No, I want to give you a better answer. Total cholesterol is very predictive. What happens is science has tried to make details out of everything. And so they have fractionated your cholesterol and your lipoproteins into lipoprotein A, lipoprotein B, and all kinds of other things that I can't even keep up with to try and better predict whether you're going to die of a heart attack. Well, there is some truth to these things, but there's some harm. First of all, it makes it confusing to people. Second of all, it gives them an out. You go to your doctor says, Mary, your cholesterol is 285, but your good cholesterol is 80, so don't worry about it. You've just been harmed. The second thing that happens to you is you eat a good diet. Your cholesterol drops to 125. Doctor says, but your good cholesterol is only 25. You better eat some more meat to get that cholesterol up. You see, good cholesterol is only a fraction of total cholesterol, and so when total cholesterol drops, good cholesterol drops. So, you know, I really just try and keep it simple for people. If you have a high cholesterol, you better do something about it. If you have a low cholesterol below 150, I don't care what your HDLs are, you're in good shape.
Dr. McDougall, we have more than 10 people here, obviously. Do you want to continue? It's up to you.
Do you want to continue? Okay.
Okay.
I've been taking blood pressure pills for about 23 years because I've never really been on a good diet, but I want to get on a good diet. But how long do I have to take the pills before I get off of them?
Okay, you must do this under doctor's supervision.
My doctor?
Well, let me tell you how you do it. So that you could tell your doctor. This is the way you do it. You get a blood pressure cuff, you monitor your blood pressure. You keep your bottom number between 85 and 100. If it's over 100, you take more medicine. If it's under 85, you take less. That's it. And beta blockers, I reduce every 3 days, but every 6 is probably good. So you tell your doctor that's the way he's supposed to help you.
Hi, I'm a raw foodist, and I was wondering how much raw plant food a raw foodist should eat a day, if any.
There are some advantages to raw food. You lose weight faster, unless you happen to be a raw foodist who lives on sugar and fat, which is fruit and nuts. Okay, if you do that...
We live off of green leafy vegetables and seeded non-hybrid fruits. Okay. 80%. The other 20% are grains, sprouted grains, and roots.
Well, it's a way to lose weight faster, get blood sugars down faster because you're on a less digestible diet. I don't recommend a raw food diet because I have a hard enough time getting people to eat potatoes, cooked, with less butter. You know, so this is the kind of diet I teach for those reasons. It's just much more practical and extremely effective. And I couldn't counsel you on how much raw to eat. There certainly are advantages to raw food. I just don't know the answer to your question.
Hi, doctor. I have been a vegan for about 4 or 5 years.
Well, you look awful healthy.
Well, most people want to lose weight, and I like to gain a little weight. I don't have much on my belt. And so what would you recommend to gain more weight? I do eat nuts.
Okay, listen to this for those who want to lose weight faster. You eat more flour products, like breads, bagels, and pastas, because flour is processed food. I don't care how whole grain it is. The mechanical grinding of the seed into flour has changed its physical properties, and so it raises insulin levels higher, which pushes more fat in your fat cells. So more flour products, then you go to more fruits, more dried fruits, more nuts, seeds, avocados, and other high-fat plant foods, and I could fatten you up with no trouble at all.
Hi, what is your comment about eating a particular diet for a certain blood type, which I've been hearing about?
The blood type diet. She wants to know how I feel about the blood type diet. Well, I want you to know that next year I have a book coming out. It's called The Shoe Size Diet. For those of you with big shoes, you eat meat. Because obviously people who wear little shoes, like in Japan, they eat rice. I will be on Oprah within a week.
How can a vegan for 8 years lower the amount of cholesterol the body makes? And is it so that eating peanut butter causes your body to make more cholesterol?
I don't think peanut butter causes the body to make more cholesterol. There are some animal experiments that were done in the 50s that show in monkeys that peanut butter was very atherogenic. So I think you should keep that in mind. Sometimes you can't lower your cholesterol, even on a very healthy vegan kind of diet. Sometimes it just won't come down. And that's why I use the natural cholesterol-lowering medicines and then on to the statins. Now, on a young woman like you, I would never put you on prescription cholesterol-lowering medicine because you're talking about 40 years of drug therapy. It makes no sense at all. But I might consider emphasizing the garlic, the oat bran, maybe some vitamin C, some dry vitamin E, because we don't want to wear that fat in the oil vitamin E, and maybe some gugu lipid to work on getting it lower. The other thing I advise people who just don't know what to do is I advise them to get a heart scan. That's an ultra-fast CT scan that takes pictures of the arteries. They got one in South San Francisco, and they may have one scanner up here. And it'll show you what the arteries look like. If they're clean, okay, your high cholesterol is not having a big impact. If it's kind of medium, well, in a couple of years, check it again. If all your efforts haven't caused that to stabilize or get better, then maybe you better get a little more aggressive. Or when you see that picture and it looks terrible, maybe you should get aggressive today. But the other thing you have to do is you have to get the sugar out of your diet. That means fruit juice, and other simple sugars. Get all of it out of the diet, and you may see a tremendous drop in your cholesterol level. You certainly will in your triglycerides.
What is your opinion about immunizations?
Immunizations? My opinion of immunization is you should not throw the baby out with the wash water. Okay, all of my children have been immunized. Not only have they been immunized with the usual things, but they've also been immunized against hepatitis A and hepatitis B, which I would recommend to anybody, especially if you travel like we do. Immunizations work. There are 3 things that have reduced the incidence of disease, only 3 things, and they are sanitation, better food, and immunization. People who say that immunizations are harmful, there's little truth to that. They can be, but I believe the benefit far outweighs the harm, and there's one immunization that I'd be a little more cautious about if I was going to do it again, and that's pertussis. I'd probably give it much later in life if I gave it at all. But otherwise, that's the protection I'd offer my family. And some people come back to me and they say, well, yeah, but we eat so good. We eat such a healthy diet. We don't have to do this immunization stuff. Yeah, okay, maybe you do now, but you don't know what next month's going to be like. I mean, this whole country could plummet into poverty or a war situation, and things could change completely as far as good nutrition goes. And I certainly want to have my family have as much advantage as possible of that great breakthrough in science. And I know a lot of people feel different, but hey, that's why it's a free country. I know sometimes people think because I'm interested in food that I should be interested in all the other different points of view. And I'd look at them all, but I have to come to the conclusion that I think is best scientifically based. Yes?
I have an ulcer on my ankle, and I've had it for almost 2 years. And I'm under a specialist, but I don't get any results.
Well, I think you should probably see another specialist.
I know, but nothing's happening.
Well, I think another specialist would be about time after 2 years. And
it takes a long time, yes.
All right. But I think there are people who actually deal with wounds. You know, that's their whole specialty of the clinic is to deal with wounds. And that's what I would do.
Thank you.
Because it's obvious you eat well. I can't tell you to eat any better.
You mentioned supplements, and I wanted to ask you specifically about 2. I've heard information over the past few years about the depletion of the minerals from our soil and the benefit of taking minerals, and I feel I've benefited from that. I feel better when I take them. I am a vegetarian and have been for a number of years, but I feel that that's something that's helped me. I wanted to ask you about that in particular. And also, if we eat primarily cooked foods, is it true that, or do you believe that the enzymes are being destroyed that help us to digest the food, and then we're not getting as much out of the food as a result of that? So do you see any value in taking minerals and enzymes, or do you put those in, you know, the same category of all supplements?
As far as taking minerals, if we lived in certain parts of Africa or in the United States 100 years ago, there is a mineral deficiency called iodine deficiency that would be important. In today's food market, we get foods from so many different parts of the world. Ocean-grown foods, grown near the ocean, grown in different states, grown in totally different soils, that any risk of a mineral deficiency because there was a deficiency in one particular soil would be compensated by food that you got from another soil. So I never see mineral deficiencies. I understand you feel better, and I know I tread on very delicate ground when I say negative things about supplements. As you saw, I recommended some too, as medicines. As far as the cooking of food, it's the same answer I would give you, is that the food is so plentiful. God was so wonderful in providing such abundance in the food that people can live on just one thing or two things. Just, you know, like in the potato famine for the Irish, they lived on 10 pounds of potatoes a day. That was virtually their whole diet. And there are places in the world today where people survive, particularly if they get enough calories from just a couple of different foods. And we take what we have in this country with such great variety and abundance. I can never imagine a problem, cooked or uncooked, of a deficiency. I just couldn't, I never see it. You know, if I actually saw it, if people came in with scurvy to my office, I'd say, wait a minute, we better rethink this. I've never seen scurvy. I've never seen beriberi. I've never seen pellagra. But I'll tell you, one of the other things with minerals, you have to be very careful, and vitamins too, because they cause nutritional imbalances. And for example, if this whole thing about beta-carotene and cancer, have you ever heard about that? When you take beta-carotene, you increase your risk of cancer. There have been 4 studies. 1 showed benefit, 1 was neutral, and 2 showed about a 20% increased risk of cancer among smokers who took beta-carotene. You say, how can that be? It's just a vitamin. It's just a, you know, plant kind of vitamin. Well, think about what happens. You have carotenoid receptors in your cell that receive all the different carotenoids. And you flood that cell with beta-carotene. It occupies all those carotenoids receptors. Now the other 300 carotenoids can't get in there and do their job. You create copper imbalances when you give zinc. You know, so when you flood the system with one particular mineral or vitamin, you take and you set the system off balance. When you flood it with fruits and vegetables that were God designed, then you don't have that problem. We know, for example, zinc increases total cholesterol in animals and decreases good cholesterol in people. Magnesium doubles the risk of heart attack, sudden death, and bypass surgery in post-heart attack patients. Iron, because it's an oxidant, raises your risk of dying of heart disease. So no, I think I'd be very careful with the minerals. I can go with the vitamins, but minerals concern me more than vitamins. Yes.
Do you believe in mammograms, and why not?
Oh, you didn't have to ask that. There's a whole chapter in the women's book on mammograms, and it's very well documented, and what it shows you is that you are being tremendously oversold. A recent study, and I ask you to write this down, go look it up, because it's the most recent and best research published. It's in The Lancet, the best medical journal in the world. It's published January 8, 2000. And it's on mammography, and what they did is they looked at the 8 studies done on mammography. They found only 2 were designed properly to eliminate bias. Both of those show no benefit from mammograms. The 6 that show benefit are so severely biased that they can't be used to justify mammography. And the solid conclusion of these authors is mammography is unjustifiable. You go to another paper published July 1st, 1995 in The Lancet by Charles Wright and C. Barbara Mueller. Their conclusion is the benefits are marginal, the harms are substantial, and the costs are enormous, and mammography should not be recommended for any age group. Okay? But it's a huge profit. So in answer to your question, you'll have to read the literature. This is huge business. And the chapter I wrote in the book, I think, will enlighten you a lot, too. I'm certainly not a mammography enthusiast. How's that? Yes.
Oh, hi. I'd like to question you about surgery. What's your opinion? If someone has a very large rectal cancer and it's been recommended that it be taken out by surgery.
Okay, good question. Rectal cancer and surgery. There are two ways to deal with rectal cancer and surgery, and I may be talking about different than you're talking about, but what your question brings to mind is an operation we used to do called an abdominal perineal resection for low cancer in the rectum. Okay, now the way the surgery is done is you take two teams of surgeons. One starts from this end and one starts from this end. And the joke is when you get the ball completely resected is the two teams of surgeons shake hands between the patient, inside the patient. Now, if you compare abdominal perineal resection to taking a wart burner, you know, fulgurator that you burn warts off with, and you compare burning the cancer off with a wart burner compared to abdominal perineal resection, the wart burner treatment has a 1-year better survival. We didn't talk about prostate examinations, did we?
I'd like to know about the surgery on prostate, too.
That is...
She's specifically talking about a TURP.
TURP. Well, you know, TURP is one way to go. When you get symptoms, the prostate enlargement's caused by the rich Western diet, by its elevation of testosterone. When the urethra gets closed down, you have to open it up. One way to do it, well, there are things you do before the TURP. You take saw palmetto, you decrease your fluid intake, particularly at troublesome times. You may get on alpha adrenergic blocking agents like Flomax. So there's some drug therapies you might want to try first. Then the next thing I would recommend is transurethral microwave thermography. It's where they take a catheter, put it up through the penis into the prostate area. They turn this microwave on with a cooling jacket. It heats the prostate, shrinks it away. Take the catheter out, you go home. There's no retrograde ejaculation, which you get with the TURP. No hospitalization in almost all cases, just a lot simpler and just as effective. So, I mean, I'd go the easy way. I don't like all that torture stuff.
Dr. McDougall, do you want to continue or should we stop it? Should we cut the line? What would you like to do?
What do you want to do?
It's up to you.
Want to go? Okay, well, go just to the end of the line. Then I got to get on the road. I got a 3-hour drive ahead of me.
Yes.
Oh, thank you. Thank you so much. My question, I have 2 questions, and the first one is, what am I to do with my olive oil jug that I have in my cabinet?
Well, maybe you have one of those little lamps that you can put the oil in and burn it. Or maybe you have an enemy in the neighborhood you could give it to.
Can you rub it on your body? Is
Yeah,
that
you can.
not safe?
No, it's okay. I mean, if you rub it on the body, it is absorbed to some extent. And people who have dry skin, I suggest that they use lotion on the skin. They don't oil it from the inside.
Okay. And my second question is, what can you do about vertical veins?
Varicose veins. There are some very good varicose veins clinics that I would go to that treat them with saline injections and laser. And if they bother you, go get them treated. Okay?
For the past 4 years, I've been on estrogen therapy replacement, and there's nothing I can take. I'm allergic to everything. Should I continue to try, or should I just forget it?
Well, the hormone replacement therapy I recommend to treat symptoms. I don't recommend it to prevent heart disease because it does not do that. In fact, it increases your risk of heart disease. I think it reduces your risk of fractures, but I think there's better ways to reduce your risk of fractures, like a healthy diet and exercise. So you would take it for symptoms. One of the reasons you might want to take it is hot flashes. Progesterone does well with that. Estrogen does too. If you have vaginal symptoms like dryness, fragility, you need to take estrogen if you want to solve that. I give the estrogens and progesterones topically on the skin, as you heard John Lee say. There's also a section in the women's book on, it's called the McDougall Program for Women, on various herbal preparations that will raise your estrogen levels, and you might try that.
Hi, my name is Sally. 7 years ago, I had breast cancer, and I went the holistic way. I didn't take radiation, I didn't take chemotherapy, and I mainly followed Dr. Day's method. Now this has been 7 years. Recently, I've been fighting this, I guess, of what I've read, the symptoms of candida. I'm diabetic, but I've been trying to just follow a program, but I don't know where that's coming from.
Well, I know the right program for you.
I'm sure you do.
It's like boot camp. Now, what would happen if I took you to Japan and I had you work in a rural village on the farm and you ate the diet of the Japanese people that lived in that rural village? Rice and vegetables, and maybe once a week you got a little piece of fish. And you had to be out there every day working in the field. What do you think would happen to your weight, your diabetes, your symptoms of candida? They go away. So do it. You don't have to, you don't have to travel that far. You can go home and do it. It's very simple. And it always works.
Hello, Dr. McDougall. I was wondering if you have an opinion about if there's any connection between alcoholism and diabetes. I have observed in my own family with my father that he was alcoholic as a young man and diabetic as an older man. And it seemed that he tried to kill himself with food as a diabetic as an alcoholic would with alcohol.
Right.
And I was just wondering if there's any
there is some research that
connection.
says that people who drink are looking for carbohydrates. Okay? And alcohol is the only close source that they have. And there's research that says when you put people on high carbohydrate diets, they desire alcohol a lot less because they're getting the carbohydrate, or desire it not at all. But I'd have to look that research up for you. I'm not that familiar with it. And I would say that your dad is probably like me and a lot of other people. He's a lustful person. I do everything to excess. So what I've discovered, because I used to smoke 2 packs of cigarettes a day, I used to eat the rich American diet with enthusiasm. I've discovered the only way to save me is to find good things that I can do to excess, like exercise and eating well. And I've turned my personality into something that will allow me to stay alive instead of to kill me, which I suspect is your dad's issue too.
I'm confused what you're talking about, I'm confused about what you were saying about linseed oil and so forth. Are you saying there's no essential fatty acid?
No, there are a couple of essential fatty acids, but they're made by plants, and you want to take them in the plant packages. You don't want to take them free. Okay, so you eat the plants.
Good evening, Dr. McDougall. It's
evening.
great to see you, and I love you. My husband went on your diet March 1st, and he was obese and had diabetes, high blood pressure, heart medication, and within 2 months, he was totally off all of his medications, as well as he's dropped 55 pounds
Amazing.
since then.
Well, you saved him.
But not only
He
that...
needs to take you to Hawaii.
But not only that, his doctor, we belong to Kaiser, is questioning everything that he's doing, telling us that he's not exactly eating the diet he should be. He's eating all the wrong foods, but he can't figure out what's going on. His cholesterol came down from 250 to 160 in 3 months, and they're still questioning it, and we keep telling them about you.
Yeah.
But anyway, I do have a question.
Well, keep telling them. And this is a common reaction. Now, there are many doctors who are changing their own diets, and I think all doctors really want to help people. I honestly do. It's just the system is so corrupt with the money and the drug industry and the device industries that you hardly stand a chance. But I would keep at it. Commonly what happens, like with the lady who cured herself of asthma, or my rheumatoid patients, they walk into the doctor's office, before they come in all crippled, and they walk in, they grab their hand, shake their hand, say, "What do you think of that?" Doctor says, "Well, whatever you're doing, just keep doing it." Next.
You mentioned flaxseed oil, and you said that there's no need for it, but I was wondering, I use the flaxseed and grind it up and put it in your cereal in the morning. Is that bad?
No, I think if you think you need more oil, that's fine. Like if your skin is dry. But there's nothing essential to adding the flaxseed, and that's the way I recommend you do it. You take as much as 5 tablespoons, grind it up in a coffee grinder, and then take it, pour it on the cereal, whatever. If you think you need more oil, but I want to tell you, when I walk down the street, I find very few oil-deficient people. In fact, most of these people have enough fats, essential fats stored up to last 500 years.
I have one last question. What do you think of the genetically altered seeds that we're growing, particularly soy seeds?
You know, genetically modified foods is a very emotional subject that I'm not an expert on. And so to give you my opinion would not be worthwhile. But it just doesn't sound right.
Yeah. Dr. McDougall, I owe you a great amount of thanks back in the 1980s. In the 1980s, I had eye surgery, and I went to doctors for about 7 years. All they wanted to do was medicate, medicate, medicate.
Yeah.
Whoops.
I think it works now. Give it a try. These guys are fast. It works now.
Right. They've done it before. Okay. And then I went to doctors for about 7 years, and they wanted to medicate, medicate, medicate after my eye surgery. And I finally went to you. I heard about you. And around 1990, I went into your office, and I want to thank you so much. I'm here today because of what you got me started on. And then I heard about Danny Vera and his program. And you told me the eye inflammation was probably caused by some medication I was taking. You made a photocopy from Merck Sharp and Dome showing that under warnings it could be life-threatening to certain susceptible people. And I looked into it further. And the question I have for you is, did you ever hear from the Secret Service? I did.
You heard from the Secret Service?
They spent 3 hours in my office because I sent them information. I sent the material to the President of the United States, who was having similar problems with his eyes, also to his sons George Bush Jr. and to his wife Barbara Bush. It was the most enjoyable 3 hours I'd ever spent in my life. In the office that day, I had a wonderful time showing them the truth about what medications can and cannot do. But you know what I discovered, too? The eye inflammation, you told me about also if I would eliminate eggs from my diet, and I did, and I got on your program, but I loved eggs, I loved omelets, I didn't want to give them up, so I wanted to prove you wrong. And I did, I went back on it again, the eye inflammation came back again, and then I got off of it again, I went back on it again. Every time I went back on, the eye inflammation got back and very severe. And
Are you still testing?
Everything is going fine. I got on your program, I lost 32 pounds, my cholesterol went down to 109, and I thank you very much.
Thank you.
God bless you.
It's not just changing diet, it's getting rid of medications that you don't need and that cause a lot of harm. I feel often that's as much a role as I do for people as trying to share with them the things I know about good food, is to get them off the medicines. Sick people take drugs. Healthy people don't. So your goal is to get off as much medication as possible. You use the medicines that are absolutely necessary, and a lot of them aren't. I mean, probably most of them aren't.
Hi, I'm Charmaine Vieira. I am standing here in front of Bella Vita Lifestyle Center. Through these doors, many suffering spiritually, mentally, and physically find relief and are filled with gratitude as God works on their heart. Great light has been given to God's church on health reform. As the right arm of the third angel's message, God's methods of treating disease will open doors for the entrance of present truth to prepare souls for the soon coming of Jesus Christ. Here at Modern Manna, we have successfully led the way in a cleansing and detoxifying program that not only touches the body, but also reaches to soul and spirit. We have found that Christ's method of ministry brings true healing. In Volume 7 of the Testimonies, page 62, we are told, "We have come to a time when every member of the church should take hold of the medical missionary work. RISEN, an acronym for our Remedial and Integrated School of Evangelism and Naturopathy, will empower you to answer the call to medical missionary work. Our program is based on the natural hygiene blueprint of the early pioneers, incorporating the 8 laws of health, cleansing, and detoxification. Learn how you can live optimally and coach people to healing from the diseases of lifestyle. Graduates of our Natural Hygiene Coach certification come from all around the world. They are motivated, resourceful, dedicated, and are making a difference through opening their own lifestyle education homes, coaching individuals, working within their local churches and communities, and broadening workplace wellness opportunities. Don't miss out on our upcoming 14-day Natural Hygiene Coach certification program. To find out how you can be involved with this amazing movement, visit us at www.modernmanna.org and click on Risen to register for the Fundamentals of Natural Hygiene. This online instruction is a prerequisite course that prepares you to successfully complete the Natural Hygiene Coach certification. Jesus says in Luke 10, verse 2, "The laborers are few." Now is the time to join us. He is waiting.